to talk about it is a little bit about eating disorders. And the first thing I'm going to do is define them as they are defined here by the National Association of Anorexia Nervosa and Associated Disorders. An eating disorder is an unhealthy relationship with food and weight that interferes with many areas of a person's life, and one's thoughts become preoccupied with food, weight, or exercise. A person with an eating disorder who struggles with an eating disorder can have unrealistic, self-critical thoughts about body image. His or her eating habits may begin to disrupt normal body functions and affect daily activities. Eating disorders are not just about food and weight. People begin to use food as a coping mechanism to deal with uncomfortable or painful emotions, or to help them feel more in control when feelings and situations seem overwhelming. So it is, when I do assessments, I generally screen, not every patient, but I often will screen. And I say screen, I ask just very specific questions. I do not ask, do you have an eating disorder or a history? Because oftentimes patients are unaware of the signs or symptoms. Many times when patients have eating disorders, they don't recognize it. Not all eating disorders are what we might think of, like somebody who's very thin and doing the self-induced vomiting. It is all kinds of different people in different shapes and different weights. So I often will ask them about if they have any sort of restricting behavior. Have they ever attempted to go several days or weeks without eating in an attempt to lose weight? Do they have like a deep dissatisfaction with their body? Do they have any food fears? Are they like really fearful of like pizza because it's like a high-fat food and might cause weight gain? Do they obsess about calories, carbs, or fats? So these are some of the questions, and then I describe some of the other behaviors that, you know, anorexia sometimes evolves over time into some like binge eating behaviors, and sometimes evolves beyond that to some purging behaviors, and I describe all the ways that people can purge. And purging can come in the form of self-induced vomiting, use or abuse of diet pills, use or abuse of laxatives, excessive exercise, and I've seen it all. And yeah, sometimes patients don't recognize these behaviors as actually problematic because it's what they do, because it's what they know, and to some degree it works.